It's time to imagine better health with CHI Health. Medicine has become highly specialized, and some doctors even have subspecialties.
Take something complex like shoulder surgery. Instead of performing a handful of procedures a year, our next guest does over 100. No doubt it makes a difference for patients.
From CHI Health, it's a pleasure to welcome orthopedic surgeon Samuel Dubrow. Good to see you, doctor.
Nice to have you back.
Yeah, thanks for stopping back.
Sure.
You're exclusive to the shoulder, right? Essentially the shoulder, surgical and non-surgical.
I am. So in orthopedics, there are several joints in the body. We know that. Anytime a joint is anytime two bones come together and they allow range of motion. The shoulder is the most complex joint in the body, and because of that, it requires special expertise and care to provide better outcomes. And the nature of orthopedics is now we have specialists in everything. If you have a hand problem, you're not seeing the orthopedic surgeon, you're seeing the hand surgeon. If you have a back problem, you're seeing the spine surgeon. Shoulder surgery is becoming the same thing, or shoulder pain, you're going to see the shoulder specialist.
You mentioned outcomes, and there's some data that backs up the difference that it's making for patients when you specialize to the degree that you do.
Right. We know that with something, for instance, a shoulder replacement, for example, if you do more than 100 a year, you're going to have much better outcomes than someone that does a handful, 5 or 10 of them a year. And that's because you can do them in a more efficient way, a quicker way, with the newest technologies, and no post-operative care better for the patient, so they improve their outcomes, less complications as well.
It seems like a lot of people have shoulder issues at least some point in their life. When I move my shoulder, I feel a little click here, a little click there. But
my father-in-law fell and braced himself and tore his rotator cuff.
But there are procedures out there, and then you specialize in this minimally invasive procedure that's fairly new. That you're in an elite group that does this procedure, right?
Yeah. So I do a lot of arthroscopic surgery. Arthroscopic surgery puts a camera into the shoulder joint, specifically for rotator cuff repairs and rotator cuffs that cannot be repaired, and you can fix those with grafts and things that patients are told previously that there's nothing that can be done for them. So there are many patients out there that have had problems with their shoulders, pain, and they've seen orthopedic surgeons who have told them there's nothing we can do for you, we can't repair this. That's not true anymore.
I want to revisit that point because I feel like that that's where a lot of people are going to come to you, is for that second opinion. But surgery is not always the answer. At what point would you recommend like a non-surgical option to a patient if they're complaining about pain?
Right, it's certainly not. Sometimes a properly given injection helps a ton, and it depends on where that injection is given. I give my injections under ultrasound guidance, so it shows me where the needle is going within the shoulder to this particular place where the pain is coming from. And I think that can help a ton in terms of pain relief. You don't necessarily need surgery if an injection works. I tell patients, if you give a properly given injection, it can last for 3 months to 6 months, and you ride that pony until it dies. You keep getting them. There's no reason to stop getting them.
Right, rather than cutting into your shoulder. But I think Mary brought up a good point. A lot of people come see you after they've been to other doctors concerning their shoulder, and sometimes they've already had a surgery on their shoulder that maybe didn't have a great outcome. And they can come to you. Are you successful in treating those type of patients?
Yeah, and a lot of those patients, either the wrong surgery may have been performed on them, or it didn't work. Now, it may not even be the previous surgeon's fault that this happened. The body didn't heal where it was repaired. Just because you repair something to the bone doesn't mean that your body's going to heal it. You can put sutures in and attach it to the bone, but the body's supposed to heal it. What we can do with surgery, we can use different types of grafts that are taken and put things inside the shoulder that help enhance healing of muscles to the bone to help improve outcomes as well.
When patients have been told there's nothing they can do, right? You just have to live with the pain or live with the issue. That is terribly frustrating. So when they come to you and you say, no, we can't help you, that's got to be like a new day in their life almost, where they feel like, that they've got a future where they can get milk out of the fridge comfortably.
There's no question. There's many patients, especially elderly patients, grandmothers and grandfathers, who are unable to pick up their grandkids, for example, and because of the pain that they're having. And if you can fix them, make them feel better, it's significantly improving their way of life.
You're getting a card at Christmas.
There's no doubt. There's no doubt.
And earlier in the show, we talked about how you give out your email address. Is that true, or are we making that stuff
It's
up?
on my card. I give my email address out to every patient I have, and I encourage them to use it because it's the best way to get in contact with me for 2 reasons. A, I get back to them usually within 24 hours, and it also saves them the trip to my office as well as the copay and costs that can be incurred from patients just to ask simple questions to me.
In fact, we're putting your email address on the screen right now, even for our viewers who are watching and have a question about, your shoulder, or somebody in your life has been experiencing pain and you just want to, like, what does he think about it? I mean, obviously there are some cases where you need to visit with a patient and look at results to get specific about it.
Right.
But he says, yeah, give him my email address so that they can call in and ask. And I want to ask you about your center and the difference that makes for patients, because this is a relatively new approach to care as well, so that patients aren't going all over the city to get certain things done before they finally
Right.
see you. What does the center do
So
for
our
patients?
Shoulder Institute is specialists in shoulder care, both non-operative as well as surgeons that take care of patients, and we can do everything for them in this center, to from imaging studies, whether it be an ultrasound versus an MRI. Ultrasounds are a lot cheaper than MRIs, and it's all about cost sharing and saving for the patient as well as giving them the care immediately, instead of coming back and forth, going from various physicians, from radiologists to orthopedic surgeons to physical therapists. It all can be done in one day.
Well, Dr. Dubrow, I'm going to email you about my click in my shoulder. You can email him too, or just go to the website. chihealth.com is a website that you can go to right there at Lakeside.
Yes, right.
And in Council Bluffs. And the number, if you have any questions, it's 402-717-0820.
What is that click? Is it just a tendon? What is
You were emailing him
And I
about
heard a
that.
pop too.
Yeah, I think you're eating too much of those mixed salty nuts.
Is that what it
before.
is?
That's
It's
what
the
it's
nuts.
doing. Yeah.
Okay, yeah, that
Thank
makes
you,
sense.
Dr. Dubrow.
Thanks for the
Have a great
diagnosis.
weekend.